Hey, it's Laura with True Well, and today we're talking about whether or not saturated fats are inflammatory and if you can have them on an anti-inflammatory diet. So, as the last 2 decades probably have increased interest in dietary styles like paleo and keto, questions and criticisms surrounding their healthfulness have obviously followed. After all, they promote a significant increase in meats and are considered a high-fat diet. The thing is, we've been fed the line that fats make you fat and unhealthy, but that sugar is okay, ever since a published study that was funded by the sugar industry in the 70s infiltrated every health outlet available, shaping the dramatic and detrimental increase in sugar consumption. This myth alone has been suggested to be a huge contributor to the rise in insulin resistance, chronic inflammation, and other metabolic disorders. A typical high-fat Western diet has been linked to potential harm by academics for years. A low-fat diet had long been recommended in the past as the healthiest strategy to lower the risk of cardiovascular disease, diet-induced obesity, insulin resistance, and other inflammatory conditions. But in reality, your body requires dietary fats from nutrition to function properly. Dietary fat is a significant energy source that aids in absorbing several vitamins and minerals. Fat is used in cell membranes, each cell's essential exterior, and the sheaths surrounding nerves. It's required for blood clotting as well as muscular action. As mentioned before, after uncovering this faulty research, saturated fat is no longer seen as such an evil character. And in reality, some fats, such as monounsaturated fats and omega-3 fatty acids, are necessary for a healthy diet. On the other hand, some fats may exacerbate chronic inflammation and impair your general health. Trans fats are by far the worst. They're a byproduct of the hydrogenation process, which is used to transform saturated oils into liquids and keep them from going stale. There are no proven health advantages associated with trans fats, and there's no safe ingestion threshold. As a result, trans fats have been banned in many countries. Now, saturated fat used to be considered as harmful, but according to new research, saturated fat is not necessarily harmful and may be incorporated into a health-promoting diet. All that to say, it's not surprising to be completely confused as a result of decades of contradictory information. So let's talk about saturated fatty acids and highlight the most recent findings of saturated fats in nutrition research to know the truth and then debunk the myths, but also to understand what kind of a role it has in chronic inflammation and if it even has a place in an anti-inflammatory diet. So saturated fats are fats that are solid at room temperature, and they may be found in red meat, palm oil, whole milk dairy dishes, cheese, coconut oil, and many commercially prepared baked goods. Now, even though in the past it was considered a bad fat, a flurry of new research has complicated that link between saturated fat and heart disease. So according to a systematic review of 21 studies, they concluded that there is insufficient evidence to prove that saturated fat increases the risk of heart disease. However, replacing saturated fat with polyunsaturated fat may actually reduce the risk of heart disease. So, do saturated fats actually fit into an anti-inflammatory diet? Now, although saturated fats have long been considered harmful, again, that newer research has shown that it really is more about quality than strictly labeling all saturated fat as bad or inflammatory. That being said, if you're considering including them in your anti-inflammatory diet, it's recommended that you do so with those guidelines in mind. Now, when we talk about quality, what that means is that your saturated fat comes from sources that are organic and as minimally refined as possible, preferably unrefined. So recommended sources would be, number one, grass-fed beef. When people hear the word red meat, they usually think of beef, which is often thought to be unhealthy as part of a high-fat diet, but it can bring certain advantages when consumed from the right sources. According to research, an animal's diet can influence the nutritional value of the meat on the consumer's plate. Grass-fed beef has been demonstrated to be lower in fat, higher in healthy fatty acids, higher in vitamins, and a rich source of a range of minerals. According to 2009 research, consumers benefit substantially from grass-fed beef. Again, as newer research is indicating that quality is the main differentiating factor, Butter or ghee can be consumed when from organic and grass-fed sources. This is because the milk fats contain those balanced omega-3 to 6 ratios that help control inflammation. Although coconut oil is nearly completely composed of saturated fat, it has the reputation of being a healthy alternative, especially in the paleo diet. It's commended for its health advantages, which include antibacterial and antioxidant capabilities, enhanced skin and oral health, and the possibility of weight loss. Medium chain triglycerides, sometimes referred to as MCTs, are abundant in coconut oil. Consuming MCTs may boost the number of calories that your body burns, and consequently, it may aid in weight loss. Research has shown that virgin, unrefined coconut oil is able to reduce inflammation, whereas refined, possibly because of that refining process, has the complete opposite effect. Now, palm oil, another tropical oil, has a comparatively high saturated fat content compared to other liquid oils at around 34%. However, palm oil is high in antioxidants, including vitamin E. This vitamin is essential for maintaining function of your immune system and allowing your cells to communicate with one another. Now, according to research, consuming enough vitamin E in your diet can lower your risk of cardiovascular disease. It is worth noting that reheating changes the chemical composition of the oil. It's recommended that these tropical oils not be reheated because if consumed then, they increase free radicals in the body, which can cause inflammation. So, bottom line comes down to two main points. Number one, the guidelines for the Mediterranean diet confirm that consuming saturated fatty acids in moderation and consuming them from the right sources can bring many health benefits and minimize the risk of inflammation, obesity, heart disease, chronic diseases, and other health complications. Number two is to make sure that when you do, they come from the proper sources. So make sure that they're organic and that they're unrefined. Making sure that both of those things are in place can ensure that you can have saturated fats within an anti-inflammatory diet without causing the harm that faulty science has led us to believe in the past. For even more information about getting started on an anti-inflammatory diet and what foods to avoid and what foods to include in your anti-inflammatory diet, check out the Anti-Inflammatory Diet for Beginners video and learn the quickest and best ways to get started on an anti-inflammatory diet. Be true, be well, and I'll see you in the next video.